What is the Elan method? The Elan method, or lengthening over nail, is a limb lengthening technique that combines the use of an external fixator with an internal intramedullary nail. This method is widely used for patients seeking to increase their height or correct limb length discrepancies. The Elan method is designed to provide both stability and efficiency during the bone lengthening process, making it a popular choice in limb lengthening procedures. How does the Elan method work? The Elan method works by using an external fixator to gradually pull the bone segments apart, creating a gap that fills with new bone tissue. Simultaneously, an intramedullary nail is placed inside the bone, which acts as an internal support. This dual approach provides additional stability and helps guide the bone as it lengthens, ensuring proper alignment and reducing the risk of complications. Lengthening process. The lengthening process with the Elan method begins after the bone is surgically cut, osteotomy. The external fixator is adjusted daily to gradually increase the distance between the bone segments, allowing new bone tissue to form in the gap. This process is done at a controlled rate, typically about 1 millimeter per day, until the desired length is achieved. One of the key advantages of the Elan method is that it is weight-bearing, which means that patients can walk with full weight bearing during the lengthening process. This capability helps maintain muscle strength and joint mobility, contributing to a smoother and more comfortable recovery. Throughout the process, regular checkups are essential to monitor bone growth and ensure the lengthening is progressing as planned. How to lengthen with the Elan method? Lengthening with the Elan method involves the daily adjustment of the external fixator to slowly separate the bone segments. This is usually done by turning small screws or knobs on the fixator to increase the gap between the bones. The intramedullary nail provides internal support, ensuring that the bones remain properly aligned as they lengthen. Patients are typically trained on how to make these adjustments themselves under the guidance of their medical team.
And handy to do it, and it should be 90 degree, and it's so easy. You can see the angle, that's it, and then I will turn it. That's it.
Removal of fixators. Once the desired length is achieved and the new bone has started to harden, the external fixator can be removed. This step typically occurs a few months after the start of the lengthening process. After the fixator is removed, the intramedullary nail remains in place to continue supporting the bone as it fully consolidates and strengthens. The removal of the fixator is a significant milestone in the recovery process as it allows patients to regain more natural movement and comfort. Recovery process. The recovery process after the Elan method involves a period of rehabilitation to regain strength, mobility, and full function in the lengthened limb. Physical therapy is a crucial component of recovery, helping to restore muscle strength and joint flexibility. Patients may need to use crutches or a walker initially, gradually transitioning to full weight bearing as the bone continues to heal. Complete recovery can take several months, depending on the length of bone that was added and the patient's overall health.
Hello guys, we came here for checking him body condition. He's really good. His body condition is amazing and his flexibility is really good. His running is good. He can jump. His bone healing is good too. What do you think? Why you are really good after 5.5 months later?
I do my exercises. Yeah, you need to stay focused. You can reach every goal if you never give up your dreams. You can reach everything you want.
Scars of Lawn method. The Lawn method typically results in small scars where the external fixator pins entered the skin. These scars are usually minimal and fade over time, but they may be more noticeable in some patients. Additionally, there may be a scar from the initial surgery where the bone was cut and the intramedullary nail was inserted. Proper wound care and scar management techniques such as silicone gel or scar massage can help minimize the appearance of these scars. When can we remove the intramedullary nail? The intramedullary nail used in the Allon method can usually be removed after the bone has fully consolidated and is strong enough to bear weight without additional support. This typically occurs about a year after the lengthening process is complete. The decision to remove the nail is made on a case-by-case basis, depending on the patient's progress and the surgeon's recommendations. Some patients may choose to leave the nail in place permanently if it does not cause any discomfort or complications.